Hi everyone, it's Kris Mastrangelo. We're here at the Provider Lounge, and today we're with KJ Page. And KJ Page, why don't you tell the audience about your facility, where you're from, and then we're going to have some questions for you.
From Chaparral House. It's a very small nonprofit in Berkeley. We were founded by a former Berkeley mayor back in 1975. So we don't have any big corporate ownership. We don't have any faith-based. We're totally independent, one of the few freestanding nonprofits in the whole country. And there's very few in the whole state too. So we're excited to be different. That makes it nice and challenging at the same time.
Right. The state of California, and for those that don't know, and tell us a little bit about your patient population, and do you think that with the impending reimbursement and policy changes that your customer base will evolve?
So we have 49 beds, which is very small. And we recently got Joint Commission accreditation and certification. We were the first in the United States for memory care and post-acute certification.
Congratulations.
So, thank
That's
you.
Pretty impressive. You know.
Thank you. Well, when we got that certification, we were then invited to the tables to speak to the larger hospitals, because we're in such a small we're such a small hospital in such a large area with a lot of other big facilities that we couldn't even get a seat at the table for the ACO conversations. Oh, you're 49 beds, you don't take people 24/7, we'll talk to somebody else. But once we got Joint Commission accreditation, that's something the insurers and the payers understood. We've always been 5 stars, and we are very proud of that, but it didn't matter because we weren't large enough to have their attention. But we're one of the few Joint Commission accredited in the whole area, and so they are listening to us now, so we have the seat at the table. So yes, our population is evolving. The major hospital that's our primary referral source now is the 90-day pocket of money that accountable care organization, the whole joint process for the knees and hips, and they're going into pneumonia and a couple of the other things. They've actually signed up earlier than for a lot of the other demonstration products. It's the Bay Area, and it's a big demographic for CMS. And so we're seated at that table. We've had a few of our joint people already, so that's a challenge in getting them in shorter. We haven't gotten the 7 days or die yet, but it's coming. We're about 14 days for a hip.
14 days now. Are you actually participating in a CJR program, or you are one of the MSAs? And so they're coming through, and you're learning, everyone's learning about this, so we know that. And how many patients a month, on average, are you admitting under that CJR model?
It's probably one or two, right. We just got our first one last month, and then our second one right before I left was scheduled to come in this week.
Excellent.
So they haven't really started a big volume yet, but they're feeling it out little by little. And the hospitals have been having meetings with the skilled nursing facilities in the area, and we have to record for them every readmission we get, every admission from them, and every readmission and why. So they actually look at that and they discuss it in a group. So, in the group of other SNFs. So you have to know your stuff and then be prepared to defend why it went back or what the decision was made. And they ask questions right there in front, and if you don't know what they're talking about, it's embarrassing. So it's kind of, I don't want to say group shaming, but it sort of is a nice way of keeping your competition up and keeping your ability to talk about maybe what happened at 5 o'clock on Friday afternoon, why the person went to the hospital. You know, all of that stuff. Your clean laundry as well as your dirty shirts all get aired at the same time.
Excellent.
So that's kind of exciting, keeping people on point and keeping people talking about it and making sure our systems behind the scenes work really well.
That's fantastic. And within that context of having orthopedic, the DRGs, total hips, total knees, and that's what the CJR bundled program is about. But in your facility, you have other patient populations, memory care. Can you tell us a little bit about the memory care and and again, today's events and the videos on memory care, and I think I truly believe with more of the understanding and compassion and empathy versus 20 years ago. Tell me, how is it going within your organization, and also what else do you see the future holding?
Well, memory care is one of our really strong suits. We're really proud of that. We took the CMS hand-in-hand training that they sent to all facilities. We've given it to all of our nurses' aides and our activity staff and our housekeepers and dietary staff.
So
everybody has it. Whether or not they use it every day is not the point, but they know what to do. So we have 0 psychotropics used for dementia in my building. I'm very proud of that.
That's
People
amazing.
come in with them and we taper them off right away. We get them engaged with the family and the caregivers, the case managers from day one. We have really good geriatricians that work with us, our medical director, superlative, and good nurse practitioners that are there every week. So if somebody's having a crisis, it's because we can't figure out what they need. It's not because they have dementia, it's because we don't understand them. So once we get to know them, sometimes it's a longer process than others, but sometimes it's really quick. If you sit down and listen to someone, it's amazing what you can find out about them. And listen to the family. It may take them 30 minutes to give you the story, but once you know that story, it's amazing how easy it is to understand that elder and what their needs are. So we have people able to meet their needs, whether they're housekeepers. You don't need a registered nurse to go fetch somebody water, right? And so all of that works together with a lot of the other dementia training we've had. We used Alan Power's books when that first book came out.
Great, yep.
I bought 30 copies, put a $20 bill in it and gave it out to staff at random. And then everybody wanted a copy. So we bought more copies for people and they read it. They were all excited. Oh, we're having a learning circle about this today. Do you want to come? I'm like, wow, yeah, sure. And the CNAs did it themselves. It was really exciting to see ideas that caught on because they worked. You could tell right away that the anxiety level went down, the calmness was everywhere, and people weren't on drugs. So it was a lot less nursing time, less side effects, fewer complaints, fewer falls. It was really nice, and it makes a nice atmosphere. We spend a lot of time by our board directive and on purpose in activities. We just won the National Nonprofit Activity Award from American Healthcare Association. We're so excited.
That's fantastic.
So excited. And I came to accept that award on behalf of our residents and staff, but we spend a lot of time, about 1,500 volunteer hours a quarter, just in activities. That's
amazing.
The big community coming in. We have high school kids start their freshman year, and they're here every year, and they don't want to leave when they graduate, so then they continue that, and they bring their kids. So it's exciting to see them growing up with our people as their adopted grandparents or aunties, and it's really fun to see that. It's amazing what a little cranky old person will do if there's babies crawling around and calling up on them, and that's kind of fun, you know. It gives them something out of their routine and a chance to be themselves, their authentic, at peace self. They don't have to remember anything. It's like when you hold a baby, everything's just you again. So that's kind of nice too.
It sounds as though you're ahead of the curve. It sounds as though you've applied practices that the government is, putting on all 16,000 skilled nursing facilities across the country, that the competency of your staff is where it needs to be and ongoing training. And I think that a lot of organizations could learn from you. And I think that your story is invaluable because when you impart that knowledge from the housekeeper to the receptionist on whatever your facility assessment defines, I think that they will realize that the operations becomes more seamless and more productive.
Yes, true. That's very true. The more people that know or they're comfortable with people with dementia, the easier it is for everybody. And when I finished those 713 pages, I admit I did the last 50 on the plane ride down here, and most all of them we have already done.
It sounds
I'm
that way.
so excited. My staff was panicking, and I sat through that overview on Sunday, or Sunday, and oh my God, but they'll do the templates. I was already taking notes what to put in the template. So we're right on speed. All the Joint Commission accreditation standards that we meet that exceed CMS, that's within the regulation. There was nothing brand new that we'd never heard of or hadn't done. So we're really excited that we feel like we're in compliance with the new regulations before November when they start. So that's always exciting for us. We have a little tweaking to do, a little more formalization in the discharge plan, but we already put a lot of time into discharge planning to keep people from going back to the hospital. And our hospitalization rate is very, very low from skilled nursing, and from discharge it's very low. We've chosen some very smart home health partners so that the first time there's a crisis, they have people on the ground dealing with it. They don't end up back in the ER. And so that helps the numbers as well, and now they're counting that. So even though our locus of control is expanding, we don't have a home health license, we can't control what happens in your home, but we make sure you have everything you need to get there, and some numbers that you can call, so there's no wrong door. That if you don't get what you need, call me, call the social worker, call somebody you know at Chaparral House, and we'll help you get through to the next person. And being small helps with that a lot too.
It does, you have control. But we are so grateful for leaders like you in the industry, and I'm sure many people are going to ask for help and advice. And
Oh yeah, sure.
thank you so much. KJ Page from Chaparral House in Berkeley, California. Thank you so much.
Thank you very much.
Thank you.